Dear audience, dear chair, let me introduce my PhD topic, which is dental management of children with special needs. My name is Lili Rozgonyi. I'm a first-year PhD student and a pediatric dentist at the Department of Pediatric Dentistry and Orthodontics. My vision is that all children in special care are smiling, and to achieve that, I would like to evaluate the effectiveness of alternative dental management in case of these children. My research is centered around three specific goals, three projects. All of them started last year autumn, and all aim to investigate the dental care of children with special needs. The title of my first project is Investigating the Effect of Alternative Distraction Techniques and Dental Environments for Children with Neurodevelopmental Disorders. Neurodevelopmental disorders are increasing globally in the 21st century, affecting 53 million children worldwide under 5 years. Due to their behavior, these children are more vulnerable for oral health diseases, where 60% of children with autism have dental caries. Oftentimes, they require general anesthesia for a regular dental treatment, but this is not always necessary. So there is an unmet need for some less invasive calming technique, which leads us to investigate alternative dental environment and audiovisual techniques. So therefore, our aim is to identify the best alternative audiovisual technique for children with NDDs. Our clinical question is that what is the effect of alternative distraction techniques and dental environments on dental management in children with NDDs? We use the PICO framework, and we hypothesize that the use of audiovisual techniques are superior to conventional dental practice. We conducted our systematic search on 5 databases with the following search key, and with the help of my co-investigator, we could narrow down the number of eligible articles to a number of 32. In the next figure, we analyzed the change of the anxiety levels in children with NDDs that were affected with the interventions compared to those who were not. It is important because these children have high anxiety levels during dental treatment, which can affect the treatment outcomes. We analyzed the standardized mean difference, where the 0 line means that there is no effect, and any values below 0 means lower anxiety in intervention, and any values greater than 0 means lower anxiety in control. We extracted data from 5 RCTs with 134 patients to assess the anxiety levels at baseline and after the dental treatment of these children. The heterogeneity was substantial, with a y-squared value of 85%, which can be due to the different type of NDDs, the different interventions used, and the different anxiety measurement methods. The overall effect was a standardized mean difference of -0.35, meaning that there is a tendency that these interventions can lower the anxiety levels in children with NDDs. In the next figure, you can see the standardized mean difference of cooperation levels in children with NDDs. In clinical practice, these children have difficulties during dental treatment due to their behavior. We analyzed 4 articles, including RCTs and observational studies, with 119 patients. The overall effect was 0.23, meaning that there is a tendency for better cooperation for these children if we use desensitization or audiovisual distraction. But this result is statistically not significant. It can be due to the high heterogeneity, which can cause by the different type of NDDs and the different intervention techniques and different measurement methods. based on the preliminary results, there are some strengths and limitations of my project. As strengths, this has a robust methodology, and they used combined studies with different scales and physiological parameters. And as limitations, there are only small sample size studies, small number of studies regarding the children with different type of NDDs, and there is a high heterogeneity. As a preliminary conclusion, we can say that audiovisual interventions have a tendency to improve cooperation and reduce anxiety in children with NDDs. As implication for practice, there is a need for train the dentists and dental staff with targeted interventions based on the type of the neurodevelopmental disorders, with focus on feasibility and accessibility. As an implication for research, there is a need for larger, well-designed RCTs where they compare directly these audiovisual interventions, and we also need patient-centered outcomes. Here you can see the progress of my first project, that we finished the data extraction, and we also received some figures, and currently we are at the risk of bias assessment phase. Let me move on my second project, which is investigating the effectiveness of visual oral health educational techniques for hearing-impaired children. Hearing loss affects 34 million children worldwide. For them, sign language and lip reading are the gold standard communication, and there is a significant difference between hearing-impaired and non-hearing-impaired children knowledge about proper toothbrushing techniques. Maintaining good oral health is essential for physical health and well-being, because if a child has severe oral health problem, he or she can have difficulties in eating, sleeping, or concentrating, so we have to do something against it. Educating children has been a vital part of preventive dentistry to improve oral hygiene, so therefore our aim is to identify the best oral health educational technique for children with hearing impairment. Our clinical question is that are visual oral health education techniques effective in improving oral health in children with hearing impairments? We use the PICO framework, where we are comparing the alternative visual oral health education techniques to the gold standard communication to sign language, and the outcome would be the change in oral hygiene status. And we hypothesize that hearing-impaired children receiving visual oral health education will have better oral health indices. So later, we can make dental health lessons more accessible for them, and they will need less invasive dental treatments. In my third project, we are analyzing data from Eurostat database, and we are investigating the access to dental care services for people with disabilities in Europe. Approximately 1.3 billion people live with a significant disability today, which means that 1 in 6 of the world's population lives with some kind of disability. Individuals with disabilities should have equal access to quality healthcare services, including professionals who are trained to their specific needs. The oral health of these people may be neglected because on the focus of their disability, because on the focus on other major diseases or the limited access to oral care. So therefore, our aim is to investigate the possibility of providing dental services to patients with significant disabilities. Our clinical question is that do children in Europe with disability have lower chance to go to the dentist compared to non-disabled children? Here we are comparing the disabled children to the non-disabled ones in Europe, and the primary outcome would be the unmet need for dental examination, and the secondary is the reason for this unmet need. And we hypothesize that people with disabilities have less frequent dental follow-up. The clinical implication is to establish a system where patients with disabilities have easy access to dental health care. As a summary, I would like to submit my first project this year and the 2 others next year. Let me end my presentation with a quote from Stephen Hawking: "The greatest enemy of knowledge is not ignorance, it is the illusion of knowledge." Thank you for your attention.
So my question is that you would like to investigate audiovisual techniques for children with NDDs, but are there any more tools that we could use, for example, in a simple dental office?
Yes, thank you for your question. And yes, of course, we can use some other tools. As Abel already mentioned before, there are some pharmacological tools that we can use. For example, benzodiazepines, and we also can restrain the child. So, but this is not a friendly thing to do, so I would not suggest it, only in case of emergency.
First of all, congratulations. And you showed us on the figure the subjective measurements of anxiety. And my question is that are there any figures in case of objective measurements, and what are they exactly?
Thank you for your question. Yes, I also have a figure about the objective measurements of the anxiety. They are measuring the pulse rate or the blood pressure or skin conductance of these children, but unfortunately, because of the lack of time, I couldn't present it today, but later I will show the results to you.
Yes, please.
So first of all, congrats, it was an amazing presentation. For your Eurostat project, you mentioned children with disabilities. I was wondering what type of disabilities you're thinking of including in your project.
Thank you for your question. Unfortunately, in this questionnaire, they didn't mention the exact type of the disability. They only mentioned that if the children is limited or severely limited in their daily activities.
Thank you.
Thank you.
Congrats on your presentation. My question is that why do hearing impaired children have less knowledge of oral hygiene? Because, well, the obvious answer would be because they're hearing impaired, but their parents, I imagine, have effective ways of communicating with them, and they can explain the importance of toothbrushing to them. So why is this significant difference?
Well, unfortunately, these children don't always have parents who can hear or who can also learn this from from a professional who can do sign language, maybe. So I think because of this, but if the parent also know how to brush their teeth, their own teeth, they can teach their children to, yeah.